Hi everyone, I'm Ridula and this is my presentation about the topic Determinants of Health in Australian Aboriginal and Torres Strait Islander Children and Youth. This video briefly describes the fragile health conditions of children and youth of Aboriginal and Torres Strait Islanders. First, let's know who these people are. An accepted definition of Indigenous Australian proposed by the Commonwealth Department of Aboriginal Affairs in the 1980s and still used by some Australian government departments today is a person of Aboriginal or Torres Strait Islander descent who identifies as Aboriginal or Torres Strait Islander and is accepted as such by the community in which he or she lives. From the analysis of different reports, it has been understood that the children and youth from the indigenous context are in a vulnerable condition. Let's discuss the overview of health issues among the Australian indigenous people. The health inequalities and poverty stand top on increasing the health death rate due to the lack of proper fundamental education. Health issues are quite noticeable than the Aboriginal community of other developed countries. Socio-financial variables are accounted as huge component behind the well-being inconsistencies, yet they don't represent much well-being contrasts inside the indigenous populace. Social determinants of health forums. In February 2015, a health forum has been held in the Sydney Metropolitan Local Aboriginal Health Partnership to improve the use of the social determinants. This forum is more successful than any other forums in the healthcare history of Australia. More than 100 participants have taken active part in this forum to nurture the 8 social determinants, which are connectedness to family, culture, identity, country, and land, access to early childhood services and education, freedom from racism and racial discriminations, appropriate and adequate housing, that is, reducing overcrowding, homelessness, and providing secure housing tenure, access to transport, access to participation, and levels of attainment in primary, secondary, tertiary, and vocational education or training, reduced, reduced incarceration and culturally determined decisions and actions with the criminal justice system, access to employment and participation in the labor force, freedom from addiction, death rate in Aboriginal and Torres Strait Islanders. Death rate in Aboriginal and Torres Strait Islanders in Australia is quite shocking as the average rate of life is decreasing due to some inequalities. People cannot be able to access the basic health treatments. Therefore, death rate is also increasing. This slide helps in determining the causes behind the sudden deaths. From the recent report of ABS, it can be determined that Indigenous people are likely to live not more than 69 years, which is 10 years lesser than the non Indigenous people. On the other hand, an average Indigenous girl born between 2010 to 2012 is likely to live for 74 years, lesser than the non Indigenous girl, who is likely to live for 83 years. In 2014, there were 2,914 demises enlisted for Aboriginal and Torres Strait Islander individuals. Many Indigenous deaths were imprecisely considered as non Indigenous in light of the fact that individual or the family were not recognized as Indigenous. That means the real number of the Indigenous bereavements is not known, but rather would be higher than the number enlisted overall. It is definite to understand the leading causes of death in indigenous lands, and those causes are cardiovascular diseases like heart attacks and strokes, self harm, accidents, and cancer. Between 2012 to 2014, of the indigenous baby death rates for NSW, Queensland, Western Australia, Southern Australia, and Northern Territory, the most noteworthy were in the Northern Territory and the least in NSW. Early childhood services and education. In order to reduce this death rate among the Australian Aboriginal community, governing body has understood that early child education is necessary. Well-being is likewise decided to some extent by access to social and monetary open doors, the assets and backings accessible in our homes, neighborhoods, and groups. the nature of our tutoring, the security of our working environments, the cleanliness of the water, nourishment and air, the way of our social connections. There has been an issue which was highlighted recently in 2016 by Department of Health, which is Aboriginal and Torres Strait Islander health is viewed in a holistic context that encompasses mental health and physical, cultural and spiritual health. Land is central to well-being. Crucially, it is must understood that while the harmony of these interrelations is disrupted, Aboriginal and Torres Strait Islanders' ill health will persist. Let's have a look at the strategies. National Framework for Health Services for Aboriginal and Torres Strait Islander children and families. Different factors affect the Aboriginal and Torres Strait Islander children and families at different stages of development. The traumatic legacy and the ongoing effects of colonization, the removal of Aboriginal and Torres Strait Islander children from their families, persisting interpersonal, institutional racism, and the impact these have on the health and the well being of the Aboriginal and Torres Strait Islander people, and the decisions about where and how they access these services. In 2012 to 2013, 48% of the Aboriginal and Torres Strait Islander adults reported that either them or their relatives have been removed from the natural families. Levels of a high or a very high psychological distress were significantly more common among the Aboriginal and Torres Strait Islander adults who have been removed from the families. This framework aims to provide the additional guidance for policy and program design, service development, and implementation that reflects these factors and enhances the scope and quality of the services for the Aboriginal and Torres Strait Islander children and their families. National Strategic Framework for the Aboriginal and the Torres Strait Islander peoples' mental health and social and emotional well-being. This paper provides an evidence base to support the current directions in the policy and strategies that aim to improve the indigenous mental health and the well-being. It provides the details of the interventions that work, and it features the important insights into how the policies, programs, and service direction should be conceptualized, developed, delivered, measured, and evaluated, and how this differs to the current mainstream approach. It confirms that the interventions are most effective when they are based on the indigenous concept of holistic health, mental health, and social and emotional well being. Enhance the self determination and control through the strong community leadership and governance, and foster connectedness to the country, culture, and identity to build on the indigenous strengths, enhance the resilience, and promote the cultural continuity. Healthy children, strengthening the promotion and prevention across the Australia. This strategy aims to stimulate the discussion about the development of a national approach to the public health of the Aboriginal and Torres Strait Islander children, and is a guide to what could be included in the National Action Plan. The purpose of the action plan is to strengthen the systems that support the health promotion and illness prevention for the children aged between 0 to 12 years, including the maternal health and the well being in the antenatal period. The action plan will focus on significantly increasing the capacity of the systems to support the communities, families, parents, and the professionals to support the health of the children. It will provide a focus on the health promotion and the illness prevention, including early interventions and approaches. The action plan will link strategic effort across the various settings, services, and systems involved in the health and the well being of the children. While much of the impetus to improve the children's health comes from within the health sector, the action plan will also address the role that other sectors and the non government organizations play by adapting an integrated approach that builds the capacity for the healthier children. Thus, it can be concluded from the overall analysis of the video that it has been understood that indigenous people are suffering heavily due to the health related disparities. Death rate is continuously increasing due to the poor economic conditions and the poor health conditions. Several strategies are being adopted for the well-being of the children and the youth of the Torres Islander people and the Aboriginal people in Australia. However, the government should partner up with the organization which support the Aboriginal and Torres Strait Islanders and support the strategies for the better outcome. Thank you.